Have you noticed your dad or grandpa losing interest in things he used to love? Or maybe you've seen that distant look in his eyes. These might be warning signs of depression that many people miss, even doctors. Today we're talking about something really important: depression in older men. Men over 65 face high risks, but they rarely say, "I'm depressed." Instead, they show it through behavior changes that most people think are just normal aging. I'm going to share 5 big challenges you'll face when trying to help an older man with depression. You'll also get practical tips for each one. If an older man in your life seems irritable, withdrawn, or just not himself, this information could really help you both. Let's start with the most urgent challenge: what to do when you worry he might be thinking about suicide. Challenge number 1: concerns about suicidal thoughts. You might be afraid he's considering suicide. You probably don't know how to bring it up. You might think, what if he's hurting more than I realize? What if asking makes things worse? Your fear makes sense, but you need to address this directly. Here's what you can try. Ask him about suicide gently, but directly. Try saying, "I've been worried about you lately, and I care about you. Have you had thoughts about hurting yourself?" This won't put the idea in his head. That's a myth. He might feel relieved, or he might get defensive. Stay calm and keep showing support. If you're really worried, secure medications or firearms in the home. Save the Suicide and Crisis Lifeline number, 988, in your phone. Share it with him or call it yourself if you need guidance. Choose a relaxed moment for these conversations, not during arguments. Remember, asking shows you care. Many people feel relief when someone notices their pain. Your willingness to talk could make a huge difference. Challenge number 2: the urgency to act. You might feel anxious about timing. What if I wait too long? What if it's too late? You should act quickly when you suspect depression. Here's what you can try. Trust your gut. If something seems off about how he's acting, look into it. Don't wait for clear proof before taking action. Start small with daily check-ins. A simple text or quick visit creates chances for him to open up without pressure. Watch for specific warning signs in his daily routine. Is he eating regularly? Is he keeping up with personal hygiene? Is he leaving the house? These basic activities often drop off first when depression takes hold. You don't have to handle this alone. Get other family members and friends involved. Different people might notice different warning signs. Any help, even if it's not perfect, beats doing nothing. Make a simple action plan with clear steps, like scheduling a doctor's appointment. Having specific tasks helps when you feel overwhelmed. Challenge number 3: difficulty communicating. If he's never talked about his feelings, how can you tell if he's depressed? You might wonder, he's always been quiet. Is this depression or just his personality? When men hide their feelings, depression can get worse without anyone noticing. Here's what you can try. Watch for behavior changes instead of waiting for him to talk about feelings. Notice changes in his sleep, appetite, or sudden loss of interest in activities he used to enjoy. These physical signs often tell you more than words. Ask about physical symptoms first. Many older men find it easier to admit they're tired or have headaches than to say they feel sad or hopeless. These talks can lead to deeper conversations. Spend time together doing activities that don't need deep conversation. Many men open up more while driving, working on projects, or watching sports. The pressure is off when they don't have to sit face-to-face and talk about feelings. Try side-by-side communication instead of direct talks. Walking together, fishing, or sitting on the porch can help him share thoughts he might usually keep inside. Listen for phrases like, "What's the point?" or "I'm just a burden now." These can signal deeper issues that need attention. Share your own feelings first to encourage openness. When you show vulnerability, it gives him permission to do the same. This builds trust over time. Wait, before I share the most important part, make sure you're subscribed. That way you'll get updates straight to your feed. Now let's continue. Challenge number 4: medical professionals dismissing concerns. Sometimes doctors might not take your concerns seriously. They might blame symptoms on old age. This can leave depression untreated and make your loved one feel even more alone. Here's what you can try. Go with him to medical appointments when possible. You can share important details about behavior changes that he might downplay or forget to mention. Make a written list of specific behavior changes you've noticed. Include dates and clear examples. This documentation really helps doctors understand the situation. Ask for a geriatric depression screening test. These special assessments detect depression in older adults who often show different symptoms than younger people. If the doctor dismisses your concerns, get a second opinion or ask for a referral to a geriatric psychiatrist who specializes in older adults' mental health. Look into telemedicine options for men with mobility issues or those in rural areas. Some older men find it easier to open up in video appointments from home. Frame mental health care as part of his overall health. Some men respond better to the idea of getting a health tune-up than to depression treatment. Don't give up. If one appointment doesn't help, try different providers. Your advocacy is crucial to getting him the care he deserves. Challenge number 5. Withdrawal from activities and social life. You might feel helpless watching him withdraw from life. It feels like he's slowly disappearing, and you don't know how to bring him back. The more he isolates himself, the harder it becomes to reach him. Here's what you can try. Create low-pressure chances for engagement. Offer to bring his favorite meal or watch a game together. These activities don't require much social energy, but keep your connection. Find ways to make him feel needed. Many older men prefer activities with a purpose rather than purely social events. Ask him to fix something or share his knowledge about something he loves. Connect him with peers through veterans groups, religious organizations, or hobby clubs. These connections provide support from others with similar life experiences. Use technology to maintain important relationships. Set up video calls with grandchildren or old friends who live far away to remind him of his connections. Consider getting him a pet for companionship and responsibility. Caring for an animal provides daily structure and a reason to get up in the morning. Start with small outings before suggesting big social events. A short walk to a local cafe might work better than a large family gathering. Keep up routines and traditions that have always been important to him. You might need to adapt them for his energy or mobility levels. Your consistent presence shows him he hasn't been forgotten, even when he can't show appreciation. These aren't just problems to solve. They represent emotional battles. You might feel torn between wanting to help and not knowing how. He might feel misunderstood and pressured to hide his pain. The real challenge lies in breaking through emotional walls built over a lifetime. Sadly, some older men face a healthcare system that doesn't fully recognize their pain. Depression in older men can come from unique triggers. Retirement can cause an identity crisis, especially if work defined his self-worth. Physical health problems and chronic pain often link to depression, making each other worse. Losing independence, like giving up driving or moving from a long-time home, can cause deep sadness. Grief becomes more common with age as spouses and friends pass away, leaving older men without their main emotional support. This journey needs patience. Progress might be slow with setbacks. Some days will discourage you, but your presence matters even when you don't see immediate results. The connections you keep today could prevent a crisis tomorrow. Take care of yourself through this process. You can't pour from an empty cup. Find your own support system, friends, a therapist, or a caregiver support group. Set healthy boundaries to protect your energy. Practice regular self-care to avoid burnout. Your well-being matters just as much as his, and taking care of yourself sets a good example. What do you do next? Now that you know about these hidden struggles and have some practical tools, what will you do differently? Start small. Have a genuine conversation, check in regularly, or simply sit together in comfortable silence. If you worry about someone's mental health, seek professional help right away. If this video helped you, please like it and share it with others who might be watching an older man struggle. Share your experiences or strategies in the comments. Your story might help someone else feel less alone. Don't forget to subscribe for more content about emotional challenges we all face. Remember, you might be the only person who notices what others miss. Your attention could save a life. Check the description below for links to resources about men's mental health and depression in older adults. Until next time, keep showing up for the men in your life. Sometimes your presence is the best medicine of all.